Okay, so my name is Ariel. Today I will be doing a medication administration today. So I've already logged into Meds Manager, and the patient I'm working today with is Simon LaRose, and I'm going to go to Lovenox because he's okay. So for Simon LaRose, an order is for 40 milligrams of Lovenox injection daily subcutaneously, scheduled for DVT prophylaxis. So it is in the injection drawer 2. Pocket 6. Okay. Lovenox 40 milligrams per 1 milliliter injection. And then 40 milligrams Lovenox injection daily subcutaneous scheduled for DVT prophylaxis. Okay. And this is for Simon LaRose. Okay, so next I'm going to go to Phenergan. And then the order is 25 milligrams of Phenergan, injection 6 hours intramuscular, as needed for nausea and or vomiting. And this is in drawer 2, pocket 4. And the order is Phenergan, 50 milligrams per 1 milliliter. And then the order is 25 milligrams Phenergan, injection 6 hours intramuscular, as needed for nausea and or vomiting. Okay. So since I would need to drop the Phenergan, I would need to do medication calculation, and this would equal to 0.5 milliliters. So I would go like this. I would go over here. I would open an alcohol pad. I would clean the vial for 10 to 15 seconds in an inward to outward motion. Okay, so now I will obtain my blunt needle, grab it by the syringe. I would undo the cap. Before I do that, I would draw up 0.5 milliliters of air. And I remove the alcohol pad, insert into the vial. I would push air into the vial and slowly draw back 0.5 milliliters of Phenergan. I would get rid of any air bubbles. And there should be no air bubbles. Okay, and then I would. Okay.
I'm going to make sure that the shiny part is facing down.
Okay, and then I would, for intramuscular, the deltoid, I would use the deltoid for 22 to 25 gauge, and normally for adults it would be for 1 inch. I would use the ventrogluteal needle 25 to 22 gauge, and also it could be 1 and 1.5 inch needle. And then for vastus laratus, I would use a 25 gauge and a 5 7 inch needle. Okay, so I'm going to untwist, and I will be starting with the deltoid.
So I'm only going to touch the outer 1 inch redness. Is that the only thing you're missing? I stopped a couple times.
Okay, and now I will log us. And before I move on, I'm going to label. So I would label Phenergan, and it was 25 milligrams for 0.5 milliliters as the volume. And I would place this around the syringe, and now I'm ready to go to the patient's
I'm gonna
room.
go ahead and get my fluoride. I will snap it and allow for the saturated kit. The first kit, place it right here. And I'm gonna get the thing ready. I'm gonna open the swab sticks, and get it ready.
Okay, so now I'm in Simon LaRose's room. I will verify his patient identity. I would ask him of any allergies to make sure that they do not interfere with the medication administration I will do. Now I will
Now I'm gonna get
scan his armband.
the saline. Take the cap off.
I'm gonna go to my first injection, so subcutaneous for 40 milligrams of Lovenox.
After I tap, I'm gonna leave it right in here. And then gently remove the blue
Stimulate the skin.
wrapper.
Okay, now I'm going to obtain the Lovenox. Okay.
Now I'm going to discard this in trash. Now I'm going to open my...
Okay, so now first I'm going to start with the deltoid. No, first I'm going to start with the abdomen.
Okay, I poured out my lube. Now I'm going to trash this in trash.
Okay, so first I'm going
Now I'm going to commit one hand to dirty, which is going to be my
for the landmarks of the abdomen, it is below the costal margins, between the iliac crest, and above the symphysis pubis. I will put my fist on the umbilicus to make sure that I am to avoid 2 inches around the umbilicus. I'm going to get an alcohol pad.
Now I'm going to pin it away from me first.
Well, first I'm going to pinch the skin. Obtain an alcohol pad. Clean inward to outward motion for 10 to 15 seconds. And I will let that dry for 10 to 15 seconds.
And last in the middle, top to bottom, towards me, trash.
I would take,
I'm still keeping my labia open.
I would angle the syringe at a 90-degree angle in a darting motion while still maintaining my pinch. And once inserted, I will release and stabilize my syringe, and then
In my lube, and I'm gonna start inserting it.
I would insert
I'm gonna insert it until I see.
I would insert 10 milliliters. I would insert it at a rate of 10 seconds per milliliter. Then I would wait 10 seconds, and then I would remove the syringe from the same angle it was inserted. I would immediately put it in the shark container and apply pressure.
And now I'm gonna
And that would be a
release my labia
subcutaneous for the abdomen.
and stabilize
Now,
my catheter. And with my dominant
for-
hand, I'm gonna blow up the balloon. Well, with my
So the
non-dominant
dose was 40 milligrams. The location was the right lower abdomen.
blow up the balloon, I'm gonna detach it, put it in a box.
Okay.
I'm gonna gently tug on it to see if I make resistance. And I do make resistance.
Okay, and now next I would go to the outer arm.
Successfully put the balloon
Okay,
catheter
so for
in my patient.
the outer arm, I would do as I did for the abdomen. I would pinch the skin, find the outer aspect of the upper arm. I would pinch the skin, clean for 10 to 15 seconds, wait 10 to 15 seconds for it to dry. I would take my Lovenox that is filled with air.
And then I'm gonna hang the urinary catheter bag.
I would take my syringe, angle it at a 90-degree angle, dart it into the skin, release the pinch, stabilize,
Perineal cure and clean up betadine or
inject at a 10-second per milliliter
jelly and clean up my
rate.
patient. I'm gonna place
I
my
would wait
patient
10
in a comfortable
seconds.
position. And I'm gonna clean
and then
of the
immediately
area.
remove the syringe at the angle it was inserted and apply pressure. Okay, and that is it for the subcutaneous.
Cover it back up.
Okay, so now next I will go to
Bag to make sure call bells
Finnegan.
and the first 2 cell rails are up.
and I would
I'm going to tell my patient they'll be
scan
back in
his
15 minutes to check.
I've been-
And at this point, I already provided.
and also it still says the same thing, so I'm going to stimulate the scan. So next I'm going to get the Finnegan. I'm going to scan it.
Put it in the trash. I'm just going to verbalize that.
Okay.
I'm going to set up the room as it was. And
Okay, so
document
for
what,
deltoid,
size
I
range, how
will
my patient tolerated it. It's always good to chart and take an output, the color of urine, and
deltoid.
the size of Foley catheter. And I'm gonna write my name.
Okay, so for the deltoid, I will
and
locate the
date-
Acromion process. I will locate it right here, which is right here. And once I locate it, I will go 3 fingers down. I would find the mid-axillary, and I would locate that and make a triangle. And in the middle of the triangle should be the insertion site. It should be soft and it should not be hard. Okay, so now I should, so before injecting, I'm going to spread the skin. I have the skin taut, clean it, inward, outward motion. Let that dry for 10 to 15 seconds. Have 0.5 milliliters of air.
Video is perfect, actually. Well, here, let's plug up your phone here and take a look at it then.
Let's do it again.
Good.
Okay, and now I'm going to insert the Finnegan at a 90-degree angle while still having the skin taut, and then release, and then insert at a 10-second per milliliter. Right, leave for 10 seconds.
Okay.
I'm gonna redo that. And then I will remove the syringe and needle immediately from the same angle, and then apply pressure for the deltoid. Okay, so next I'm going to do 25
Up over here, it's charging.
deltoid. Okay, and then for ventrogluteal, I will locate the greater trochanter and place my palm on the patient's left or right hip, depending on my position. I would point my thumb to their groin and the index finger, my index finger to the anterior superior iliac spine, and then my middle finger towards the buttocks. And then I would locate the triangle, and it should be a soft spot. If it is not, I can go down an inch further, and I should be able to feel the gluteus medius muscle, and this would be the injection site. So I'm going to place a gauze right there too. I'm going to obtain a alcohol pad.
There's one that was over on there.
And then before that, I'm going to Z-track. So you would Z-track, clean the area. You would get 0.5 milliliters of air. You would insert at a 90-degree angle.
So, that's how you like it?
You would aspirate to make sure there's not any blood. And then you would insert or inject at a 10-second per milliliter rate. Then you would take the syringe out at the same angle it was inserted, immediately put it into the into the sharps container and then apply pressure. Okay, and next for the last one is for the vastus lataris. So next you would locate the femur condyle and the greater trochanter, so this. And I would put my hand right here. And then you would divide the thigh into 3 parts, horizontally and vertically. And that I normally do. You can do this way also as well. This will help also. But I'm going to divide it horizontally and vertically into 3 parts. And your insertion site should be the outer middle third. So I'm going to put my finger right there. I'm going to Z-track. I'm going to clean the site where I will be injecting for 10 seconds. And then I would put up 0.5 milliliters of air to inject. 90-degree angle insertion. Aspirate for 5 to 10 seconds. And then inject at a 10-second per milliliter rate. Hold for 10 seconds while still remaining in the Z-track. Exit the syringe at the same angle it was inserted. Put the needle in the sharps container and apply pressure. Okay. And then after I've done that, I will document all of my injection sites, and I will log out. And I will reset the room and put everything in the sharps container. And I would throw everything away, and I would make sure that his bed is locked, the side rails are up, and the bed is in the lowest position. I'll make sure that his call light is there, and I would ask him if he needed anything else. So, and this would conclude my demonstration. Thank you.